living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Just how helpful is diabetes education? Well, studies show learning about diabetes and getting support lead to people taking better care of their health and keep them out of the hospital. The bottom line is people with diabetes do not know what they don't know. And learning about diabetes can answer questions you didn't even know you had. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Today we talk about diabetes and the power of education. Stay tuned. Welcome back. We start this morning talking with Sue Larson, a certified diabetes educator. Thanks for being with us this morning, Sue.
Thank you, Ben.
And welcome back, because you've been on our show before. So before we talk about diabetes education, can we just start by talking a little bit about diabetes? Statistics show that millions of Americans have diabetes or pre-diabetes, and they don't even know it. How is that possible? How do you not know if you have diabetes or pre-diabetes?
Well, the symptoms of diabetes can be really subtle at first. Such as increased thirst and urination, being tired, blurry vision. A lot of seniors associate it with aging. So until blood sugars are quite elevated, people often don't have overt symptoms, and it's picked up in a routine screening.
Okay. And there are two types of diabetes. We hear people have type 1 or type 2. Can you explain what those differences are?
Sure. Type 1 is an autoimmune condition when the body destroys the cells in the pancreas that produce insulin. So people with type 1 diabetes need to start insulin from day one to stay alive. Type 2 diabetes is the one that can be much more subtle. It generally happens in adults over the age of 40, and they are still producing some insulin, but their insulin isn't working properly. Either condition with the lack of insulin or the insulin not working properly results in high blood sugars.
How do people get or develop diabetes? Are there risks?
Yeah, classic risk factors for diabetes are aging, so being over the age of 40, family history, and we don't get to select those top two, sure. We have no control. Being overweight and inactive, certain ethnic groups are much higher risk. People who already have high blood pressure or high cholesterol can go on to develop diabetes as well.
So we talked earlier that sometimes people don't know when they have diabetes or pre-diabetes. Are there things they should be looking out for to might be warning signs that something's going on?
I'd say the increased thirst and urination, blurry vision that may come and go, being tired and lethargic, dry mouth, cuts and sores that don't heal well, or increased infections. I think the best thing people can do, especially over age 40, is make sure they're seeing a provider so they can get their blood checked at least every 3 years, and then as people get older, it often is every year.
Oh, okay, that's good to know. And so if someone is sitting at home right now and thinking, oh, that's me, I am tired, or I am showing those symptoms, what should they do?
They should call their provider and schedule an appointment so they can get a blood test. And they can diagnose diabetes two different ways. A blood test called a hemoglobin A1C, and when that comes back at 6.5 or greater, that is diagnostic for diabetes, or a fasting glucose level of 126 or greater is positive for a diabetes diagnosis. Prediabetes falls in when fasting blood sugars are elevated, but below those diabetes cutoffs, fasting blood sugars of 100 to 125 are diagnostic for prediabetes.
Okay, so if someone does go and see their doctor and their numbers are in those ranges that you just talked about, why do you think it's important after learning that information and getting that diagnosis that they work with a diabetes educator?
I think it's real important that they, ask their provider if their provider doesn't give one for a referral to a diabetes educator. I think first of all, it's very overwhelming and scary at first. Mm-hmm. So a diabetes educator can help teach them if they have about how to make healthy food choices or increase movement. We might get them started with blood glucose monitoring. It's also just that support. And we're really a coach. We're going to help people make changes within their own lifestyle to control their blood sugars. And it's very individualized. There's not one diabetes diet for all clients. Everybody's different. There's different ways to approach it. So the diabetes educator can really help with that.
Perfect. And so is that when you go see a diabetes educator, is when you're diagnosed, or when should you consider seeing a diabetes educator?
Well, I think when people are first diagnosed, and if they're first diagnosed with prediabetes, they might be referred to a registered dietitian who might not be a certified diabetes educator, and that's okay. But at initial diagnosis, I encourage clients to check in yearly just to make sure they're staying up to date on their tests, exams, and vaccines. It can be a device check where it gives us an opportunity to check their blood glucose monitor or their continuous glucose monitor. There's so much new technology. It's also an opportunity to talk to people about, hey, did you know that you might be a candidate for a continuous glucose monitor now?
So you talked a little bit already about what a diabetes educator does, being that coach and that person that can give you that education. Can you talk a little bit about what it is like if someone sits down with a diabetes educator? What can that person expect?
They can expect the diabetes educator is going to ask them some questions. It's called an assessment. I mean, I really want to focus on what the client wants to talk about to help individualize it or personalize it to what's going to work in their lifestyle. So usually it's a one-on-one session. Sometimes clients will choose to go into group classes. I'd say the majority of my clients prefer to be seen one-on-one in a private setting. It usually takes about an hour. And we're going to work with them and hopefully give them some recommendations and also focus on what they're doing right.
Perfect. Yeah, it's always nice to hear what you're doing right
That's
instead of
right.
what you're doing wrong. So really quickly, we're almost out of time, but money is an issue for those people who need this extra help. Is it covered by insurance?
Yes, it usually is. And Medicare has excellent benefits for diabetes education when people are newly diagnosed, and then ongoing yearly benefits for both diabetes education and medical nutrition therapy with a registered dietitian. So if someone doesn't have a diabetes education program in their region, they can usually find a registered dietitian who can also provide that service.
Perfect. Okay, thanks. We do need to pause here for just a quick break. But coming up next, we'll talk to a person who has diabetes and found out just how valuable diabetes education can be. Don't go away. We'll be right back. Welcome back. Joining us now is Cass Mitchell, who has diabetes, and Sue has stuck around. She's the certified diabetes educator who worked with Cass. So Sue, thanks for staying with us, and Cass, welcome.
Thank you. Glad to be here.
Thank you. We're glad to have you. So let's start with you, Cass. When were you diagnosed with diabetes?
I was diagnosed in 1992 when I was still a professional chef in California in the Napa Valley.
And did you have symptoms or have any indication that you might have diabetes, or how did that happen?
A couple years earlier, I'd been told that my blood sugar levels indicated prediabetes, but I didn't know what that meant. I didn't take it seriously.
And then when you got that diagnosis, what were your first thoughts? How did that make you feel?
Well, it made me angry. I felt like all I knew about diabetes was that you couldn't ever eat sugar again, and I was a professional chef, and I thought, what? So it was a problem.
So you said that you didn't take it seriously. When did you start taking it seriously, and when did you bring in Sue?
Well, I was living in California at the time, and so my physician directed me to take some group classes and gave me a lot of literature, and I started in on oral drugs, and then some years into that, I think maybe 10 years into it, my disease had progressed to where I needed to start taking insulin, and then I got really serious about it. Because once you're taking insulin, if you screw up, you can kill yourself or go into a coma.
Right, yeah, any
get very ill.
medications, you need to be careful with that, so that's good. So Sue, when you started working with Cass then, so she mentioned that she was a chef. When you try to individualize people's plans around their lives, how do you go about doing that, and how did you do that with Cass?
Well, we talk. And I listen a lot and try to focus on what did Cass want to focus on. what were her interests. If she didn't want to talk about food, we didn't need to, and we could talk about something else. And introduce Cass to some different technology, some new technology over the years that we've known each other. It's been several years, so that's kind of the approach. It's so personalized and one-on-one. Everybody's different.
So at this point in Cass's management with her diabetes, you see her about every 3 months, right?
Mm-hmm.
And so is that pretty typical, or does that depend on the person? How often do you know when to work with somebody?
It really depends on the person. Sometimes we see people once or twice, and then they choose not to see us anymore. Sometimes people get the benefit out of seeing us, and they're really utilizing their benefits from insurance, and they choose to come back every 3 months for follow-up and support. And that's what I think what we're really doing is that we're past the teaching point and we're at the support portion.
So Cass, let's go back to you. When you learned about how you needed to take care of your diabetes, what were you able to do that still did fit with your lifestyle, especially with being a chef?
Well, learning, for instance, carbohydrate counting, which is an essential part of maintaining good blood sugars. Vegetables are carbohydrates, There's many things to figure out about what's going to affect my blood sugars, including emotions, stress, physical activities. And so I became more acquainted with the effects of those things on my blood sugars, and I was testing with my meter, and still, though, it was an imprecise thing. What ended up happening was that Sue recommended I get a CGM, a continuous glucose monitor, which is a little device attached to my body. And I can just look at my cell phone and see exactly what my blood sugars are and treat accordingly. And that has been revolutionary in my self-care. It's really improved my situation.
That is very cool. So what would you say was the hardest thing that you had to adjust to or accommodate to be able to manage your diabetes?
I think my brain was the big problem. I just didn't want to have it. I was in denial. It was a pain. And yet, the thing that's hard to accept about diabetes is that it's a lifelong condition. I don't know that anybody really recovers, I suppose a few, but you have to deal with it. Like, if you want to have continued health and a high quality of life, you have to come to grips with what you've got and use the tools at hand to produce the highest level of health.
So what would you say is the most valuable thing that you've gotten with working with Sue and having that diabetes educator support?
Well, in terms of hardware, definitely the CGM. I would never have gone there without Sue's urging, because it just felt like hardware devices, modern medicine. I'm a suspicious and rebellious type. So I needed persuasion from someone who's very good at it.
Sue, can you talk about what that is just a little bit? I'd never heard of it before, to be honest. Okay. So what is that device and what does it do for folks?
Well, a continuous glucose monitor is a tiny hair-like sensor under the skin. It's monitoring their clients' glucoses every 5 minutes, 24/7. Depending on the device, the one that Cass has can alert her to lows and highs. And it not just tells her what her glucose is at that time, it shows her what direction she's going at what rate of change. And Medicare started covering this for some clients who were on multiple daily injections of insulin in the last few years. So that's why some people aren't even aware that it's a possible benefit.
Okay, well, it's cool, and I'm glad it's helping you, Cass. So, Sue, Cass clearly is a little bit feisty. She talked about that her brain was kind of her biggest barrier to overcome. Can you talk a little bit about if somebody is sitting at home and they're in denial too, what's your advice to them right now?
I guess I'd say find a diabetes educator, find one you fit with. We all have different approaches and styles on how we work with things. Some clients prefer to see someone else than me. Cass and I were just a really good fit. We have been. So I encourage them to see their provider, ask for a referral to a dietitian or a certified diabetes educator, and just go in with an open mind, give it a try. They can go in once. If they never want to go back again, that's okay. But statistics are less than 10% of Medicare clients ever see a diabetes educator once in their lifetime. And you live with diabetes every single day.
Yes,
So-
for sure. And you mentioned that too. And we are really close to being out of time, but I wanted to finish with you, Cass. Any closing thoughts that you would give to somebody watching right now who has diabetes or maybe at risk?
I would urge them to be proactive in their own self-care and give it their best shot, because it's only going to make a positive difference in their lives.
Perfect. Thank you so much, ladies, for being here and for sharing your story, Cass. Coming up next, knowledge is power, and getting diabetes education is good sense for good health. But what are the options for getting diabetes education and support? We'll tell you right after these messages. Don't go away. Thanks for staying with us. We've talked about why diabetes education and support are so important, but how do you get it and what can you expect when you do? Joining us now is Marcy Butcher, a certified diabetes educator and dietitian who works with the Montana Department of Public Health and Human Services. Marcy, thanks so much for being here.
Thank you so much for having me.
So let's start with that question. How do you even begin? If you now know you have diabetes, how do you get a hold of a diabetes educator?
Great question. Diabetes education is now vastly more available in Montana than it ever used to be. It does require a physician referral if you are going to have insurance cover your diabetes education. So talk to your doctor about a referral to diabetes self-management education. It is something that we're encouraging persons with diabetes to really be self-advocates and really ask for. It is an absolutely important part of self-care and is a standard of clinical management of diabetes. So doctors are wanting people to go to diabetes education as part of a really team-based effort to help have a healthy life with diabetes.
Okay, perfect. So when you get that referral from the doctor, what do you do?
So typically, either the diabetes educator will get that referral and reach out to you, or you can reach out to the diabetes education program and ask to set up an appointment. They're really good about working with the physicians and wanting to reach out to you, and so they'll typically call you to schedule an appointment. But don't feel like you have to wait for that. Please call and make that appointment.
Okay, great. And what about in those areas, we're very rural and other states are too, when there isn't a diabetes educator, what are the options there?
Boy, great question. And there are a lot more opportunities again than there used to be. Telehealth is a real option for diabetes education. So a lot of the more rural clinics and facilities are connected with some of the larger entities in Montana, the larger clinics that do have telehealth capabilities. So you can ask your doctor to get a referral to diabetes education and see if you can have that visit via telehealth, or depending on how far away that is, you could travel. But telehealth is certainly a wonderful opportunity now, and that's becoming even more and more greatly available here in Montana.
That's awesome. And I know there are maybe some group classes. So Mountain Pacific Quality Health has the Diabetes Empowerment Education Program, or DEEP. Can you talk a little bit about that program?
Boy, great question. The DEEP program is a free diabetes education classes, 6-week class, weekly classes that are aimed at Medicare beneficiaries with diabetes or prediabetes. And they're really targeting rural and sort of far-flung communities that don't have access to a diabetes educator, and that providing basic education and then giving the clients or participants in the classes those self-advocacy skills to work with their diabetes education team, their provider, and then reach out to a diabetes educator so that they can get their individualized care through that health team. But it's wonderful peer support and basic education in these communities, and they're oftentimes offered by MSU Extension agents or peers with diabetes in these communities. So they know their communities, they know their resources, and it's a wonderful opportunity to get some help and support.
How does somebody know if there might be a DEEP class in their community?
If you want to go to Mountain Pacific Quality Health's website, you can do that, but also these classes are typically listed in community calendars. The newspapers oftentimes advertise, but the community calendars and reaching out to extension agents in the community also will probably have a good idea of those classes.
And if there aren't classes, I understand there are also some online support groups. Would you recommend people look into those?
Boy, absolutely. Peer support, they're finding that this is one of the things that really helps people do well with diabetes, and having that positive reinforcement and understanding of difficult situations, and having just somebody to bounce things off of and really understand where you're coming from is really important. And so there are a number of peer support things online. The American Diabetes Association is particularly reputable, as are a couple of other things I would suggest. Diatribe, so diatribe.org, and then Beyond Type 1 is a peer support typically for people with type 1 diabetes, but they have a brand new website for people with type 2 diabetes, and I just checked that out. It's phenomenal. So if you look on beyondtype2.org, you should be able to find that one as well.
Those sound great. And so if people are out there looking around and maybe they don't hit those that you just mentioned, what should they keep in mind when looking for a good support group online?
Right. So typically those .org are the groups that are .org are very reputable. They're highly scientific based and are very careful with their content, and they're curated oftentimes. Just be aware that if you're sharing personal information and getting sort of suggestions from others back, you have to really be cautious of that, because you want to take those to your provider and really have those discussions, or your diabetes educator, and have those discussions, because some of the things, as we know, that you can find online are sort of wacky. Sure. And not real evidence-based, so we want to be sure you're getting accurate, individualized healthcare for you and what works in your very real life.
That is good advice. We don't want to just believe everything we read, right? So talk to your provider. So we're just about out of time, but I want to talk about one more website that's in the works here in Montana, montana211.org. Can you talk about that quickly?
Absolutely. The montana211.org is a website and phone number that folks can call to find out statewide resources. And so pretty soon there will be loaded all the diabetes education sites in Montana. And so if you call that number or use montana211.org on the internet, you should be able to locate diabetes education programs near you.
Awesome. Thanks so much, Marcy, for being here.
Thank you.
Appreciate your time. And I want to thank Sue and Cass for being here as well. And thank you for tuning in. We hope you'll come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.